Good afternoon and welcome to today's webinar. Thank you for joining us. Sorry for the delay. There is a global technical difficulty with GoToWebinar, so we will not be able to be on camera today. My name is Andrea and I am the Femur Program Manager at the Partnership for Maternal and Child Health of Northern New Jersey, which is providing today's program. Our webinar today is titled Saving the Babies, Talking to Expectant Parents About Fetal Movement. I would like to review some information before we get started. The planners and speakers do not have any financial disclosures to make. Immediately after the webinar ends, as well as in an email, you will be invited to take a post-program evaluation. We appreciate your feedback, so please complete the survey. To receive the certificate of completion, including 1 nursing contact hour, you must log in, listen to the entire webinar, and complete the evaluation survey. Certificates of completion will be sent via email within 1 week of the webinar broadcast. This program is being recorded and will be available on the partnership's website and YouTube channel until October 27, 2023. We will be muting all attendees' microphones during the presentation, but we would love to hear from you. Please write the questions in the question box and the speaker will respond to as many as possible at the conclusion of the presentation. Now I would just like to turn this presentation over to Emily Price from Count the Kicks.
Thank you so much. It's wonderful to be here with all of you today. I am the executive director of a nonprofit organization called Healthy Birthday, Inc. And our nonprofit created the evidence-based Count the Kicks public health campaign. It's my honor to be here with you today with Vuann Foster, our Count the Kicks ambassador for New Jersey. Vuann?
Thank you so much for having me today. Hello, everyone. My name is Vuann Foster, and as Emily said, I'm the New Jersey ambassador for Count the Kicks. I'm also the founder of Life After 2 Losses, which I founded after suffering 2 second trimester pregnancy losses.
Thank you, Vuann. We have a highly effective, evidence-based stillbirth prevention campaign, is what Count the Kicks is. We developed an early warning system for moms, and we're saving 1 in 3 at-risk babies in Iowa, where the campaign started. Our campaign is ready to go and low cost, and we are excited to be here with you today to talk more about the importance of fetal movement monitoring and how to have those conversations with expectant parents. We'll send the link out. Perfect.
Fetal movement monitoring is low cost, non-invasive, and can help identify fetal growth restrictions earlier and decrease premature births. Study also shows that having women count fetal movements can improve maternal-child bonding during pregnancy as the mother starts to get to know her unborn child. 84% of Count the Kicks app users who count daily report that our method helped with bonding in pregnancy. 77% of Count the Kicks apps users who counted daily report that our method helped reduce anxiety. In Idaho, where Count the Kicks has been implemented for more than a decade, there has been no increase in the C-section rate over the same time period.
And this is the research article from Norway that started the entire Count the Kicks stillbirth prevention campaign in our country. The study found a 30% reduction in Norway's stillbirth rate when expectant parents were educated on the importance of and method for tracking fetal movement in the 3rd trimester. Dr. Ruth Fretz, a Harvard stillbirth researcher, was a part of the Norway study and is a member of the Count the Kicks Medical Advisory Board. You can read more about this study on the importance of tracking fetal movement in the 3rd trimester, as well as a host of other studies on reduced fetal movement by visiting our website, counttthekicks.org.
Definitions and facts. Stillbirth. A stillbirth is a loss of a baby after 20 weeks of pregnancy. Stillbirth is further classified as either early, late, or term. An early stillbirth is a fetal death occurring between 20 and 27 completed weeks of pregnancy. A late stillbirth occurs between 28 and 36 completed pregnancy weeks. A term pregnancy occurs between 37 or more completed pregnancy weeks. On average, 23,500 babies are born still every year in the United States. Miscarriage. A miscarriage is usually defined as a loss of a baby before the 20th week of pregnancy. Infant mortality is the death of an infant before his or her first birthday. On average, about 22,000 infants die every year in the United States. Here is the impact of stillbirth in our country. This data is from the CDC. 1 in 169 pregnancies end in stillbirth. The racial disparities persist. Black moms is 1 to 96 pregnancies. Hispanic moms is 1 to 199 pregnancies. Indigenous moms is 1 in 138 pregnancies. And in white moms, it's 1 in 204 pregnancies. Asian Pacific Islanders is 1 in 233 pregnancies, just as prevalent as infant mortality. Families 10 times more likely to lose a baby to stillbirth than SIDS.
America's maternal health crisis shows that every year in the US, about 700 women will die from childbirth complications and 23,500 babies will be stillborn. This is all according to the CDC. Severe maternal morbidity is almost 5 times more common in women who have stillbirth deliveries than in women who have live births, according to research in obstetrics and gynecology. Principal investigator Dr. Elizabeth Wall-Wheeler demonstrated that when mothers deliver a stillborn baby related to issues like obstetric hemorrhage and preeclampsia, their lives also become at risk. According to the CDC, a Black woman is more than twice as likely to lose her baby to stillbirth than her white neighbor, colleague, or friend. She is 3 times more likely to die of pregnancy complications. 1 out of every 96 pregnancies among Black women will end as stillbirth, as Vuan just told you. Hispanic and Native American women are also at greater risk of delivering a stillborn baby. As part of its Hear Her campaign to reduce maternal mortality in the US, the CDC lists 15 urgent warning signs for pregnant women. The importance of paying attention to babies' movements is one of the key 15 urgent markers. Given the recent calls to reduce the national rate of severe maternal morbidity, new public health initiatives and practice guidelines are needed to highlight and address the morbidity risk associated with stillbirth identified in this study, wrote Dr. Wall-Wheeler and her colleagues. By implementing a proven stillbirth prevention campaign in your work, we know that you will also dramatically improve the health of mothers. Through our early warning system of tracking fetal movement, we have a community of moms who are in tune with their bodies and their babies, letting providers know when something feels off. Time and time again, fetal movement monitoring works, and babies are being saved across the country. Based on scientific evidence, Count the Kicks, which is the only campaign of its kind in this country, educates expectant parents about the importance of tracking fetal movement in the 3rd trimester. Again, this is all based on research, which shows a change in what's normal is an indication there may be something wrong with the pregnancy. The tragedy of stillbirth and maternal mortality and morbidity can be avoided in many cases when an expectant mother alerts her doctor to critical changes and is taken seriously when she speaks up. The living proof is in some stories that we have collected from families in 24 states and in 3 countries. Our goal as an organization is to reduce stillbirth, maternal mortality, and morbidity in New Jersey, along with Vuan's help and your help as well. Our early warning system educates expectant mothers to take time each day to get to know their baby's normal movement patterns and speak up if they notice a change. And the metaphor for it is that just like adults, babies move differently and can become weaker when they are in distress. When you and I don't feel well as adults, we want to lay in bed, we want to lay on the couch, and oftentimes we become weaker. It's the same with babies. If they are in distress, their movements are going to change. A variety of issues may develop during pregnancy to cause a baby's movements to change, things like a failing placenta, cutting off nutrients to the baby, preeclampsia, umbilical cord complications, maternal fetal hemorrhage, and infection of the uterus. Our campaign is one of a kind in the US, teaching expectant parents that when a baby's movements change, it is an early red flag and they must alert their provider. So this is the method for paying attention to babies' movements. It's the highly effective method that we've been teaching moms for over a decade. We teach the method for and the importance of tracking fetal movement. Research shows the benefits of expectant moms tracking their baby's movements daily and learning how long it normally takes their baby to get to 10 movements. After a few days, moms will begin to see a pattern, that normal amount of time it takes her baby to get to 10 movements. And the reason why this is important is because every baby and every pregnancy is different. So Vuan and her pregnancy, perhaps with King Cairo, it took 10 minutes to get to 10 movements on average. And one of my pregnancies, perhaps it took my baby 30 minutes. But I needed to know that 30 minutes is normal for my baby, and Vuan needs to know that 10 minutes is normal for her baby. If your normal movement pattern changes during the 3rd trimester, this is a sign of potential problems, is an indication that the expectant mom should call her healthcare provider. We do not pretend to be medical experts. We simply provide this education to arm expectant parents with this knowledge about the importance of fetal movement. And then we get out of the way and let providers take it from there to investigate if in fact something might be wrong or if that baby just happens to be having an off day. We know that a change in fetal movement does not always indicate distress. That is for certain. But what we do know is that when we give moms this knowledge and these tools to help track their baby's movements, they're better in touch with their body and their baby, and they have real data to take to their provider. Our app, which you'll see in a minute, gives real-time data of what that baby's normal is and how it perhaps may have changed over time. And so when providers a few decades ago might get a mom calling them or coming in and saying, gosh, something feels off, I'm not sure, I just don't know. Now you have highly educated moms who are in touch with their body and their baby saying, this is my data. Look, check out this app or check out my history that I've been tracking on paper. You know, what used to be normal for my baby isn't happening anymore. And so that gives you real-time data to investigate and figure out if in fact something is wrong or if that baby just happens to be having an off day. So as I mentioned, we started in Iowa. We started out of loss, similar to VAWAN. There were mothers in our community who all lost babies to stillbirth or infant death. They wanted to keep other families from enduring the kind of loss that they have. And so with the help of the Iowa Department of Public Health, the Norway research, working with high-risk specialists, obstetricians, midwives throughout our state, they came up with what is now the Count the Kicks campaign. And you can see on this graph, and this is why I'm showing you Iowa, is because it's where the campaign has started and has been the longest. Looking at this graph, the red line that you see there is the national average, the national stillbirth rate average. The blue dots or the teal dots are Iowa's stillbirth rate. And you can see the trend over time is that the national stillbirth rate has remained relatively stagnant. And the teal dots are Iowa's stillbirth rate, which you can see the trend line down. As you know, it's not a straight trend line down. There are a couple outliers. There are certain things that Count the Kicks cannot help with, like a syphilis outbreak or a COVID pandemic. We have seen the trend line down, and what this represents is a 32% reduction in our state's stillbirth rate over a decade. In the first 5 years was the steepest decline we've seen. That was a 26% reduction in our state's stillbirth rate. Within that, in the first 5 years of our campaign, we saw a 39% stillbirth rate reduction among Black women. And so for the decade that we've existed, we now have the lowest stillbirth rate on record in 2020, even despite COVID. Actually 2018 was the lowest, and 2020 is a very close second. At the same time that our stillbirth rate has been going down, compounding risk factors like obesity and smoking while pregnant have actually gone up in Iowa. So the fact that we're still seeing a significant stillbirth rate reduction, despite things like obesity and smoking while pregnant going up in our state, we're seeing a dramatic decrease. And this is exactly the kind of decrease that we would like to see in New Jersey with your help. We do have partners across the country who work with us to bring Count the Kicks to their state. They're listed on their screen, on your screen right now. Florida Department of Health, Ohio, Alabama, Georgia. I won't read all of the names for you, but we essentially started in the Midwest. And in the last couple of years, we really started branching out across the South. And then we launched in our first Western states earlier this year, Arizona and Nevada. We'd love nothing more to bring the full campaign to New Jersey as well.
So we have sent out more than 2 million pieces of educational material to providers across the United States. We offer 2 different kinds of posters. One is a brochure and one is an app download reminder cards, all in English and Spanish. Anyone in our state can order these on our website, counttthekicks.org. Anytime they wish. We do not currently have a funder in New Jersey, so you would have to purchase these at the cost on our website.
We have loads of free resources, however. You can find them at countthekicks.org. We have downloadable kick counting charts that you can give to expectant parents who may not have a smartphone or a tablet. We have childbirth education lesson plans. It's a quick 2-pager you can easily implement in childbirth education classes. We have loads of stillbirth prevention research. While Count the Kicks is the trademarked campaign that our organization has created, the importance of fetal movement monitoring has been known to providers for decades. It's one of the oldest markers of monitoring a baby's health. We simply put together the tools and resources based on evidence so that providers could have the easy conversation with mom and partner. We have Count the Kicks frequently asked questions in 10 languages. We have more than 80 baby-safe stories that you can read. We have educational videos and testimonials. We have instructions on how to have the kick counting conversation with your patient. This is all completely free on our website. You can access anytime, available to you.
So our app is available in 12 languages, which you see on the screen. Available for Apple and Android products. You can restart your session or delete a kick. You can set a daily reminder to count the kicks. You can review your kick counting history. You can download your history to share with your provider, family, or friends. Count the kicks with twins. You can track future pregnancies on the same profile and manage multiple devices registered to your app. It's even available on the Apple Watch. As Emily said, I used Count the Kicks for my 3rd pregnancy after I finally made it out of the 2nd trimester. So if you have any questions about how to use the app, I'm going to put my email address in the chat, and you can feel free to reach out to me if you need help using the app.
Thank you, Voyan. Appreciate that. Oh, quick run through of the app and how it works is if you tap on the blue footprint there you see on the right side of your screen, every time a mom feels a movement during her kick counting session, a kick, a roll, or a jab, she taps the footprint and then the app times how long it takes her baby to get to 10 movements. And after mom has her kick counting session for that day, she's going to see a graph like the one on the right that's in pink and red. And it's going to show mom what her baby's normal is. So this baby's normal is about 15.5 minutes to get to 10 movements each day. And you can see it's pretty constant. It goes from, 15 minutes, 16 minutes, 17, 15, 15, all around right around the same amount of time, roughly. So if this baby, who usually takes 15 minutes, all of a sudden takes 2.5 hours, that graph is going to visually shoot way up and be an indicator and a reminder to mom and a nudge to mom that she needs to call her provider. She needs to let them know that this baby's normal is completely off that day and let them know what she's seen and let the provider take it from there. Whether you perform a biophysical profile, an ultrasound, whatever, a non-stress test, whatever it is you feel necessary, or whatever the provider feels necessary to investigate and see what's happening is wonderful. Again, we are not medical providers. We're simply providing the tools and resources to pay attention to fetal movement based on evidence. We do have, in addition to making our Count the Kicks educational materials that are available for you online, we also have training for healthcare providers on how to effectively implement Count the Kicks and how to have the kick counting conversations with patients. It's a great way to learn more about our campaign and earn CE credits. So I will send, along with the video links, I'd be happy to send a link to take the CE training as well. It's only $40 and you'll earn a 1.5 CE credits. So the CE training also teaches how to recognize and check biases when serving patients of color. We also talk about how to download and use the Count the Kicks app, how to best utilize the free tools and resources, how to respond if an expectant mother says they're experiencing reduced movement, and how to answer those most frequently asked questions. So I'll skip through that.
It looked like it was fine. Well, we have our first question in the chat. It says, how does your kick count program work? Which I believe we answered, but.
Oh, excellent. Go ahead, Voyan.
Okay. I also just wanted to say that these are some of the beautiful babies who we've saved by counting kicks, their moms and their healthcare providers. These faces are all across the United States and are living proof that Count the Kick works. In many of their stories, their doctors say that they would have not been here if they didn't speak up and notice a change in movement. We're now happy to answer any of the questions you may have, including how does kid count program work?
I don't want to make an assumption as to what you mean. Do you mean like how does it launch throughout a state? How do you talk to patients about it or implement it in your own personal office?
Well, if someone could please clarify what they mean by this question, that would be greatly appreciated. Whoever asked this question, if you could just clarify.
I guess I could answer it in simple terms if this is helpful. So if you are, I think most attendees today are a provider, whether an OB nurse or a doula or a midwife, or from a community-based organization, which we're really thrilled to have you here today. Basically how it works is you can implement this campaign right away if you like in your conversations with expectant parents. So you can go to countthekicks.org, click on the button that says order materials, click on the state of New Jersey, and then order anything you might need, from the brochures that we have to posters that can be hung on walls to little business card size business cards that we have that basically talk about our app and have a QR code to download it. And then those make it really easy to have the conversation, hand it to an expectant parent, let them know that this is evidence-based, and that paying attention to their baby's movements is important. And if they notice a change in what's normal, that they need to speak up and tell you and take it and let you take it from there. Some real components of our campaign are the empowerment of mom and giving her the tools and resources so she is in touch with her baby's movements and her baby's normal, so she can speak up to you and let you know if something has changed. We hope that never happens. We hope nothing ever changes in a pregnancy and it's completely healthy. But we know in the instances where fetal movement does change, it can mean the difference of a baby getting here safely and a baby not getting here safely or alive. And so I don't know if I answered your question exactly what you were looking for, but the easiest way to basically implement the campaign is to order the materials, and then you take advantage of all the free resources that are on our website. We know that other apps also have kit counters, like Baby Center or bump.com. They also have kit counters. Ours is the only one that I know of that is evidence-based and is strictly for fetal movement monitoring. We don't have a contraction timer or anything else like that. We don't have ads or pop-ups or anything like that on our app. It's simply as a nonprofit trying to provide a resource to expectant parents.
And feel free to use my email address in the chat. I can help facilitate some of this. I'm also available to do webinars and Zoom meetings if you would like to talk to your potential patients about Count the Kicks. Do we have any other questions? So our next question is there a best time of day for a pregnant person to be focused on counting?
I love that we can hear King Cairo in the background. That's awesome.
He's just waking up. So sorry.
It's a beautiful sound. Thank you, Brianne, for sharing him with us. A specific time of day, that's a great question. There is research that shows that healthy babies tend to move a lot at night. And so that is one piece of research that I have seen in the last couple of years. However, when it comes to kick counting, I think whatever is convenient for mom, right? So mom may work a night shift, and most convenient for her might be when she gets home at 8 o'clock in the morning. So really whatever is convenient for her, or whenever her baby is normally most active, is the best time of day to count. So every mom is different, every schedule is different. It basically depends on what's best for you and your schedule, and when your baby is most active is truly the best time of day to do it, but it might be different depending on mom.
And speaking of that, I noticed for my pregnancy, my baby was most active it was about 4 or 5 in the morning. So that's when I counted kicks. Our second question is, if a pregnant mom starts feeling the baby move before the 3rd trimester, should she start counting? And I can actually answer this question. So for high-risk pregnancies, you typically will start counting kicks at 28 weeks, even though that's in the 2nd trimester, but that's when it's recommended to start if you have a high-risk pregnancy.
We actually have a couple babies. In fact, the one on the screen in the middle with the peach and teal hat on, that is sweet Nala. She was actually part of the video that was going to play earlier, but her mom started counting kicks because she was high risk. Her mom started counting kicks at 25 weeks, which is typically earlier than what research says babies can actually show you a pattern. And so Nala's mom was counting at 25 weeks and noticed a change and spoke up. And she had severe preeclampsia. And long story short, even at 25 weeks, a change in her movement alerted her provider that something was really wrong and they needed to get her here safely. And so she was delivered at 25 weeks and 5 days after mom alerted provider to a change in movement, and provider made that determination that she needed to get here. She was safer on the outside than she was on the inside. She's now a healthy 3-year-old who's just absolutely thriving. And so even though the research shows and the guidance shows 28 weeks and then 26 weeks if you're high risk, we do have a couple of stories that we've collected that actually are earlier than that. So
thank you, Emily. Our next question is, did you say that you have a paper chart as well?
We do. If you go to counttthekicks.org, there's a section for just providers. It's a provider academy, and that is where you will find the downloadable paper chart for any mom who may not have broadband or smartphone or Apple Watch, obviously. And you can there's the paper charts are in English and Spanish, and actually I think even Haitian Creole as well. We actually have worked really closely with the FEMAR in Miami-Dade, and they came to us and said, we'd really like your materials and your app in Haitian Creole in addition to the English and Spanish you like. And so we worked with the Florida Department of Health to make that happen. And so I believe that you can find paper charts and the frequently asked questions in those languages. It's
so
just
someone
can easily print. I'm sorry.
It's okay. Someone left a comment and they said, I'm actually on the website now looking for materials. So way to go.
Oh, great.
Our next question is, you mentioned counting with pen and paper. Is there a way to count that way? Which I think we just answered that. And how would you recommend it?
Yeah, absolutely. It's actually pretty easy. So on the chart, you'll see basically what mom does is write down on the chart what time she started counting. So right now it is 1:36. So what you would do is write down that you started counting at 1:36, and then you put down 10 tick marks. Every time mom feels a kick, a jab, or a roll, just like you do on the app, you write down a little check mark or a tick box, and then you look at the time again for when you finally got that 10th movement. And then you'll know how long it took your baby to get to 10 that day. So let's pretend like it was 16 minutes today. You can do the same thing again tomorrow. Write down what time it was you started counting, and then get to 10 and write down what time you ended, and then you'll know. And then you'll start to see a pattern, whether it was 16 minutes every day or 15 or 4, kind of depending on whatever was normal for your baby. You do not have to have a smartphone, tablet, anything like that to count kicks. This existed long before apps and websites did. So the method has been around a long time before smartphones and apps. That's a great question.
Thank you. So our next question is the app free? And that's a yes. And is it available for both Android and iPhone? And that's also another yes.
And it will remain free to the day I die. That app will be free to all users. And it is available in 12 languages, which is a really great feature that other kit counting apps also do not have. Is the availability in 12 languages, and we'll consistently add more as we receive funding for it.
So our next question is, how can birth workers, doulas, midwife, etc. get the word out? So you can repost Count the Kicks post on social media. You can also make pretty cool content yourself. I recently made a cool reel on Instagram with my son with his Count the Kicks onesie on and him kicking his feet. So you can also make your own materials online as well and direct them to Count the Kicks social media or the website.
And ordering the materials is a great way to start the conversation with moms. Feel free to order as many brochures as you need, and use. There's tons of education on the trifold brochure, frequently asked questions, some myth busters. You know, a lot of moms are told, oh, don't worry, your baby's just running out of room, or things like that. And so we do some myth busting on the trifold brochure, as well as just the simple education on how to actually track your baby's movements. It's a great conversation starter to be able to just hand the brochure over. And the way we often talk about it, and I think a highly effective way to talk about it, is to be very positive about it. Even though it's a stillbirth prevention campaign, which is incredibly sad and tragic for the families that endure that, this is an empowering way to talk about stillbirth prevention. You know, you can monitor your baby's health and play a role in making sure, you know, that they help get here safely.
It's a great point to make. Our next question is, do we know from the app data of any stillbirths that happened that Count the Kicks didn't catch? If so, do we know what the cause of death was?
That's a good question. We have a couple of research studies on our app users who have agreed to be a part of it right now. And what I do know, and I can share this with you in the follow-up information as well, is a study that was done of about 1,200 of our app users showed that the stillbirth rate among women who used Count the Kicks in their pregnancies was statistically significantly lower than women who did not know about fetal movement monitoring. But the question was, did the app miss any stillbirths? And I think of the 1,200, I believe, if I remember correctly, and I don't want to misquote it, I believe one woman started using it early at like 20 weeks and lost her baby. And so she reported that she lost her baby while using the app, but she was also using it at around 20 weeks, which is not when babies can show a pattern yet. That is, had it been a week earlier, this country would have recognized it as a miscarriage instead of a stillbirth or a second trimester loss. And so to honestly answer your question, I believe that one person did report it, but I believe that her pregnancy was in the 20th week.
Thank you for answering that question. So the next question is the app available in other languages? And yes, the app is available in 12 languages. Sorry. Okay, the next question is, are there any free materials we can download to give out to our patients from New Jersey? And yes, Emily went over that. She said there's an area on the website where you can get free resources.
Look for the Provider Academy, and that will have lots of resources there for you.
Okay. Next question is, how do you recommend incorporating the father or partner in fetal movement monitoring education?
That's one of the cool things about our app is that everyone could log into the same account. So partner could have it on their tablet, and mom could have it on her iPhone. And mom could track during the day when she's at work, and then on the weekends, partner could sit down with her on the couch or wherever and track on his or her tablet. And but it would still be the same account. So you basically would share the login, and it would be just fine on multiple devices. So on mom's iPhone, on partner's tablet, and then it would all register, so the data is all synced and the same. It would be the same history over time and everything. So that's a great way to involve them. We also recommend involving siblings. If mom has a toddler at home, it's a great way for toddler to put hand on belly and say, oh, I felt one there, and mom taps the footprint. And it's a great way for that sibling to start bonding with their new sibling.
So our next question is, you shared you would meet with programs to discuss in more detail. How would I go about scheduling with my team? I put my email address in the chat. So if anybody has any questions and wants to contact me, you can feel free to do so. And then Emily and I can be in touch with you from there if she's okay with that.
Happy to. I just put mine in there as well. Actually, I think I only did it to organizers and panelists. I'll send it to everyone. I'll make sure that you have it. So my email address is in there as well. We'd be happy to host presentations anytime, webinars, Q&A sessions, anything you like, we'd be happy to do.
So we have another comment. Someone said, yes, the best sound. I love hearing the baby in the background. Thank you. I'm so sorry that the videos are not working. He was dressed and prepared in his little Count the Kicks onesie. Our next question is, should a mom reach out to the doctor as soon as she notices a change in movement, even if it's the first day?
I would say yes. We have heard too many stories of moms who didn't want to bother their doctor, who wanted to wait until their appointment that was a few days away. If they're seeing a real change in what's normal for their baby, if they have what researchers call mind fetalness, where they have a feeling and they're noticing that something is wrong, we absolutely encourage them to go, to call or to go. Do not wait. So many providers would say, I wish that they hadn't have waited. And really at the end of the day, the worst that can happen is you show up and be seen, and baby was having an off hour or an off, afternoon, and mom is sent home and is just reminded to keep counting and paying attention. So our message is to encourage moms to call. If they notice a change that seems significant and worrisome to them, we encourage them to call right away and not wait. It is especially helpful for rural moms. It's especially helpful for working moms to have that extra nudge that they're not crazy, that they're not going to bother their doctor, that's what providers are here for. And that's why hospitals are open 24/7.
So we have a similar question. It says, if someone notices a change in movement, is there anything you suggest they try first? Change position, eat something, etc., before parenting?
Researchers used to, or clinicians used to say, sit and drink orange juice, sit and drink some really cold water. And the most recent research over the last 3 to 5 years is actually going the opposite direction. They've seen too many moms wait around and drink juice, and it's actually not helpful, because the juice is basically for sugar or for a cold temperature, and that just gives you false reassurance. If that baby moves one time because you have drank juice, it's a false reassurance, and I would really hesitate to encourage a mom to drink something sugary or to wait very long. If they feel like something is wrong, and their data, especially on their app, is showing them that something has changed, what research is showing recently over the last 3 to 5 years, and in my opinion, hearing from too many moms who did wait and waited too long, I would say forget the sugary drink. If you feel like something's off, call your doctor and let them decide for you.
Thank you. Our next question is, how much variation is normal for fetal movement? How will a mother know if it's normal variation or an issue that needs to be addressed?
That is one thing that research has never been able to show, and we get that question a lot. what is the alarm limit, right? Like if your baby normally takes 5 minutes, is 10 minutes the next day an alarm? And so because research has not been able to show what that quote alarm limit is, we do not advise moms on a specific alarm limit or a specific variation of when she needs to go in. Instead, our education and evidence-based advice to them is to get to know what's normal for your baby, and if normal changes, to call your doctor. So we let mom be the determiner, be the determining factor in whether she calls her provider or not. But there is urgency to our messaging that if you've noticed a change, if it's bothering you, if your gut instinct and your data are telling you that something has changed, there's no harm in calling your provider. There's no harm whatsoever. And again, what we've noticed from providers is that they like Count the Kicks. They like that expectant parents use it, because you now have a mom who's completely in touch with her data and what's been normal and can tell you how it's been off, instead of a mom who may not be sure what's changed. And so I'm sorry that there is not a great answer for you related to alarm limits, but it's only because there's no evidence or research behind like what kind of variation should trigger a mom to call her doctor. So we do not educate on that or have data on that.
So the next question is how to become a New Jersey ambassador.
Oh, we would love it. We would absolutely love it. I know Vuan would love help. We actually have a second woman who will be joining us here in the near future, and we would love to have more voices and more help in New Jersey. So my email address is in there, and so is Vuan. So reach out to either one of us, and we would love to speak with you more about what it means to become an ambassador, what it entails, and all of that. We'd absolutely love to have more voices in New Jersey. Thank you.
Yes, I could definitely use your help. So the next one says, thanks for answering that question. Next question is, out of those 1,200 moms, how many reported that their babies was in distress? And were they able to get here safely because of the app?
Yes, we received quite a few what we would call baby safe stories that we didn't even know about, didn't even know existed, except for when the researchers reached out to them, they said, your app saved my baby. And what I'll do is also in the follow-up is I'll send you the data related to the study. It is being reviewed for a full manuscript right now. So the full study has not been released yet, but we recently, we are presenting to SMFM in February at the annual conference, which will also be in AJOG. And we also, there is an additional conference, the American Public Health Association. We also, and so we have a poster presentation related to that. So the data that I have is like the early data, and then by February will be the full data that I can share with you on like number of babies saved by the app in that study and things like that. But I do know that there were a handful of what we would call baby safe stories that we learned about as a result of interviewing those moms.
So then our next question is that a real thing when the mom can sense something is wrong?
It is. Research even has a name for it called mind fetalness. And it is essentially, when I mentioned Dr. Ruth Fretz, who's on our medical advisory board and is a professor at Harvard, she said you cannot, this tracking, getting to know what's normal, getting to know that normal amount of time it takes to get your baby to 10 is really important. But she said what's just as important is that instinct. You cannot put a price on what we would call mind fetalness and knowing your body, knowing your baby, and knowing when something feels off. In many cases, and in studies that have been done across the world, that almost sort of motherly instinct should not be discounted, and the importance of it.
Thank you guys so much. This is Andrea, and I'm back. That's all the time we have today for the questions, but I definitely want to thank Vuan and Emily for all your time and effort with this presentation. You answered a lot of questions, and your program sounds really great. As I mentioned in the beginning of the program, I'm the Fetal and Infant Mortality Review Program Manager at the partnership. And I know FEMUR was mentioned throughout the program, so I just wanted to give a quick overview of the FEMUR program. FEMUR is the Fetal and Infant Mortality Review for New Jersey. And in that program, we take case findings and medical chart abstraction along with maternal interviews in order to present the data for the fetal and infant losses in New Jersey. And that data we use to collect and identify trends in order to try to reduce the fetal and infant mortality rates in New Jersey. So my information, along with Vuan and Emily's, will also be in the chat. And the partnership also has other programs on their website. But for today, that's all we have time for. I want to again say many thanks again to our speakers, Vuan Foster and Emily Price, as well as Karim Amadeo, who's handling our technical and on the back end of our program today. And I know Karim's probably a little stressed today because we had a lot of technical issues that were out of our control with the program and global outages. So thank you so much, Karim, for keeping it all together in the background for us. Just a little short reminder that you will receive a link to a post-program evaluation. Your feedback for the evaluation is important, so please take the time to complete. Certificates of completion will be sent via the email to provide on the evaluation. So make sure that the email you provide us is correct, and you should receive in about 1 week the certificate of completion. A calendar of the partners' upcoming virtual programs can also be found on our website at www.pmch.org under the Professional Education tab. Also, we offer on-demand recordings of this program that we have today, and also we had 3 previous programs for the month of October for Perinatal Loss Awareness Month, and any other educational programs, they are under the Education tab on the partnership website, all of which are listed there on the website. So we thank you, and we hope that you all can join us again for some more upcoming educational events. Thanks again, Vuan, and thank you, Emily, again, and thank you, Karim, for the background.
Thank you so much.